Welcome back, everyone. I'm Steve.
And I'm Scott.
Together, we're Backyard Musings, Apple Valley, People's Republic of Cali Atlan.
And we're talking about science and technology today. This is an interesting story.
Yeah. A powerful new pill,
This is a good story.
has been shown to bring down stubbornly high blood pressure that resists standard treatments, according to results from a landmark global trial. The drug baxdrostat. I wonder, that's its scientific name. I wonder what they call it.
Maybe the guy's wife's name was Baxdro.
That could be. Lowered blood pressure by nearly 10 millimeter mercury. Is that mercury?
I think it is mercury, yep.
On average. Enough to slash the risk of heart attack, stroke, and kidney failure.
That's bad. Those three things right there are bad.
Yes, those are bad. Findings from the study were shared on August 30th at the European Society. Oh my gosh, man. Let's do that takeover.
Oh, no.
At the European Society of Cardiology, ESC, Congress 2025 in Madrid. Nice town.
When did we ever start acting on perfection?
And published at the same time in the New England Journal of Medicine. Would you like to know more?
I'd have to catch myself here. Around the world, an estimated 1.3, this is serious. An estimated 1.3 billion people live with high blood pressure, hypertension. In roughly half of these cases, the condition remains uncontrolled or does not respond to standard treatments. This group faces a sharply increased risk of heart attack, stroke, kidney problems, and early death. In the UK alone, here we go with the UK again, about 14 million people are affected.
They keep records,
That's
man.
A lot of people.
They don't have a political agenda. They keep records. You know what I'm saying? I've got high blood pressure. I take losartan, little tiny white pill.
Yeah, I know. I've been prescribed that pill too.
Yeah.
It's just,
yeah. To address this challenge, researchers launched the International baxHTN trial, directed by Professor Brian Williams of the UCL Institute of Cardiovascular Science and sponsored by AstraZeneca. There we go.
Pharma, right?
Big pharma. Big pharma.
Yep.
The study tested a new oral drug, baxdrostat, with close to 800 patients taking part across 214 medical centers worldwide.
After 12 weeks of treatment, participants who received baxdrostat in a 1 milligram or 2 milligram once daily dose in a pill form, that is pretty small, experienced an average reduction in blood pressure of about 9 to 10 millimeters of mercury, right?
Yeah. Like more than centimeter.
Yeah, more than those given a placebo. Well, that's good.
Yeah.
This decrease is significant enough to meaningfully lower cardiovascular risk. Roughly 40% of patients taking baxdrostat achieved healthy blood pressure levels compared with fewer than 20% of those on placebo. Professor Williams, the trial's principal investigator and lead presenter at ESC, said achieving a nearly 10 millimeter mercury reduction in systolic blood pressure with baxdrostat in the baxHTN phase 3 trial is exciting.
Oh,
okay.
Yeah.
As this level of reduction is linked to substantially lower risk of heart attack, stroke, heart failure, and kidney disease.
Yeah. Blood pressure is strongly influenced by a hormone called aldosterone, which helps the kidneys regulate salt and water balance. Some people produce too much aldosterone, causing the body to hold on to salt and water. This aldosterone dysregulation pushes blood pressure up and makes it very difficult to control.
Addressing aldosterone dysregulation has been a key effort in research over many decades, but has been so far difficult to achieve. Baxdrostat works by blocking aldosterone production, directly addressing this driver of high blood pressure, hypertension. The ESC 2024 hypertension guidelines recommended a target blood pressure of less than 130 over 80 millimeter mercury.
Whenever the nurses say that, they leave out the millimeter mercury. They just say 130 over 80.
Right. But, I guess that's a good one. So prior to 2024, the target had been 140 over 90. So I've that 140 over 90, that'll just about knock you out for for like a DOT physical or something like that.
Yeah.
Yeah.
Really?
They'll knock you out or tell you
Wow.
have to go take some blood pressure pills, get your blood pressure down, go
Huh.
take a nap.
Well, if you didn't have such a scary nurse, trying to wrap this thing around me, I
That's
wouldn't be
part
so
of it.
nervous.
They call that white coat syndrome, I
Yeah,
think.
yeah. Professor Williams, chair of medicine at UCL, said, quote, "These findings are an important advance in treatment and in our understanding of the cause of difficult to control blood pressure. Around half of people treated for hypertension do not have it controlled. However, this is a conservative estimate, not a liberal estimate, and the number is likely higher, especially as the target blood pressure we try to reach is now much lower than it was previously."
Quote, in patients with uncontrolled or resistant hypertension, the addition of baxdrostat, 1 milligram or 2 milligrams once daily to background anti-hypertensive therapy. So that's the hypertensive. That's the what is that? Is that the opposite of hypertension?
No. It's just another. But I think this is an adjective. Hypertensive. Hypertension is a noun.
Anti-hypertensive therapy led to clinically meaningful reductions in systolic blood pressure, which persisted up to 32 weeks with no unanticipated safety findings. Again, going on with a quote, this suggests that the aldosterone is playing an important role in causing difficult to control blood pressure in millions of patients and offers hope for more effective treatment in the future.
I don't know that important role is the right, important is nefarious role.
We're just the messengers, right?
Yeah. That's all we are.
I mean, I didn't come up with that.
No.
So.
Historically, higher income Western countries were reported to have far higher levels of hypertension. When you're working 80 hours a week, that whip is cracking your back.
Yeah. You got all kinds of debt.
Yeah.
Your girlfriend's pregnant. Your wife doesn't know
food
about
on the
it.
Table. Yeah. Oh, yeah. That's a big one.
That is a big one.
Huh. Historically, higher income Western countries reported to have far higher levels of hypertension. However, largely due to changing diets, adding less salt. Salt tastes so good, though.
You have to add salt.
You have to add salt.
And butter. You can never have enough of that.
Ice cold milk.
Ice cold milk.
Huh. The number of people living with the condition is now far higher in Eastern and lower income countries. More than half of those affected live in Asia, including monosodium glutamate, including 226 million people in China and 199 million in India.
Wow.
Large population.
That's a large.
It's probably 1% of the population, though.
226 million. That's close to our.
Yeah. Half of our population.
330 million, right? 330,
yeah, they're at billions. India and Russia are in the billions, single-digit billions.
Professor Williams added, quote, the results suggest that this drug could potentially help up to 500 million people globally and as many as 10 million people in the UK alone, especially at the new target level for optimal blood pressure control. Okay, so this might be the miracle drug, right?
Yeah, I wonder, is it a one-time deal or do you have to keep taking it like Losartan to keep it down?
I don't know.
It's a wonder drug.
I'm the wrong person to ask. So I've got plenty of those little pills if you want any.
I never took the chloroquine pills in Iraq and Afghanistan because
you still got them?
No, I threw them away, man.
We're incriminating ourselves.
But I had them up to the last day. I had the bottle so that people would think that I was taking them. Diarrhea, man. Yeah. When you slide them in the first, when you're feeling something burst, diarrhea.
All right. Take care, everyone. We'll see you tomorrow.